The Center for Innovation is really a new initiative on the part of the institution, and it's a maturation, I think best explained as a maturation from a program that we started several years ago in the Department of Medicine called the Program for Innovative Healthcare Delivery. If you were to Google the word innovation right now, you'd probably find in the last 5 years 10,000 articles and probably 50 books. So the definition of innovation is quite variable and can be looked at a variety of levels. As a working definition in the center, we define innovation as discovering and implementing new ways to deliver better health care. Our focus is on the delivery spectrum of the global health care set of activities. You can also subcategorize innovation in a number of ways, and we look at it broadly as having two ends of a spectrum. At one end, we would categorize innovation as being sustaining, which basically means doing the things that we're doing today, but doing them better, more effectively, more efficiently. On the other end of the spectrum of innovation, we would categorize innovation as transformative, doing new things, things that we haven't thought about. The focus of the center is across that spectrum, but we're hoping to make larger contributions at the transformative end than at the sustaining end. At the beginning of the 20th century, the Mayo brothers provided arguably the greatest innovation in medicine when they developed the integrated group practice, which we take for granted now, but in fact was a totally novel concept at the time, bringing together a group of people with different skills, different doctors that would work together on salary to take care of patients with complex problems. And then many of the innovations that followed, those by Henry Plummer, for example, the tube system, the unit record, for example, were tactics to facilitate the integrated group practice. What I think Mayo has recognized now is the need for and the opportunity for Mayo at the beginning of the 21st century to introduce the kind of innovations that were introduced 100 years ago, to make the same sort of impact on medicine and the care of patients and the diagnosis of disease and the prevention of disease and the understanding of disease that all these new tools allow us to apply. We've been very fortunate in that we have considerable interest among grateful Mayo patients as philanthropists who have contributed to the initial resources for the center. And I think finally what Mayo contributes is its focus on the patient and its long-standing history of trying to develop new ways to better care for patients. So we like to look at it in terms of we're inspired by the past of Mayo, but we're innovating for the future. Based on the methodology that we're beginning to appreciate and to learn of an evolving discipline of innovation, we think that by identifying trends, many of these trends are outside of the immediate medical care delivery systems, the traditional academic medical centers. By looking for opportunities within these trends, by recognizing that new business models, that industries that never were concerned about healthcare delivery, like Google, Microsoft, et cetera, are becoming involved. That we can use this methodology, this discipline of innovation, to identify opportunities. And what we hope to convey is that innovation is increasingly a discipline surrounded by an evolving science. People can learn how to innovate. There's a methodology that's associated with it that we can share with all of our employees. And we see as one of our major responsibilities facilitating the ability of every member of the Mayo family, including our patients, to be able to help us innovate. I'm most excited about the possibility that over the next decade, through the efforts of not only the Center for Innovation, but the enormous intellectual capacity that exists in this organization, that we can influence the future of medicine globally for the 21st century. That's what I'm excited about. As we've developed the concept of the Center for Innovation, we've recognized the need for multiple components, units, if you will, and multiple skill sets. We were fortunate that we had already developed the Spark unit, which is most easily understood as a laboratory for testing patient-centered research projects. Spark was an integral component of the Program in Innovative Healthcare Delivery in the Department of Medicine, was instrumental in many of the innovations that we introduced, and will play the same role within the center, but expanded beyond a single department across the entire institution. The skill set of this group, I think, is now well accepted as being critical to the success of the institution, and is based on the ability to observe, learn from observations, formulate questions based on those observations, prototype potential solutions to those questions, and then move to full-blown implementation. Innovation is and should be the responsibility of every member of the Mayo family. The ultimate determinant of our success will, to a large extent, depend upon our ability to implement new solutions within Mayo. Hopefully some of these will be generalizable beyond Mayo, but to implement them within Mayo, we need to establish partnerships, good working partnerships with departments, divisions, centers, leadership, etc. I believe that the leadership of Mayo recognized the need for adapting the Mayo model of care for the 21st century. That adaptation has to retain the values, the patient as the center of everything we do, but at the same time recognize the tremendous changes that are occurring and the opportunities that those changes present to develop a new modernized Mayo model of care. Currently, the three main areas of focus of the Center for Innovation are e-health, prediction and prevention, and promoting the competency and culture of innovation.